So this day last week, the European Medicines Agency authorised a third new vaccine from AstraZeneca for use across Europe and puts us in a situation where we now have 3 really effective vaccines to use against this disease, which compared to where we were even a few months ago is beyond what we would have hoped for, and that's a really strong position to put us in. So I asked the National Immunisation Advisory Committee, which is the expert group that advises on vaccine policy, to advise me so that I could advise the Minister what we should do in terms of who we should offer which vaccine to. And based on their advice and our considerations, I've advised the Minister that we should use the first 2 vaccines, the Pfizer and the Moderna, the so-called mRNA vaccines, for people over the age of 70 because of their superior efficacy based on the information that we have available to us at the moment. We fully expect to have further information in relation to the use of AstraZeneca, but we already know this will be a very effective vaccine for the rest of the population. But we want to prioritise for the people over the age of 70 the use of the mRNA vaccines, really effective vaccines, because this is the group of people who are most vulnerable to the infection. It's really good that we're in a position where we can offer these really effective vaccines, the most effective vaccines, to the people who've suffered most from this particular infection and those who are most vulnerable to this infection, and that's those people over the age of 70. We've seen very significant mortality among that age group, and we've seen substantial numbers of people having to be hospitalised from that age group. And so we've got a really effective vaccine, and it's important now that we prioritise this group for the use of those vaccines. It's also true to say that people over the age of 70 have spent most of the last year cocooning. They've had to suffer the effects of not only the disease, but also the economic and social restrictions that are in place. And I'm sure must have wondered, would there be ever a way out of this? We really now are excited about the fact that we've got 2 really effective vaccines that we want to prioritise for use among this age group, and that's a really good position that we're in. We know that each of these vaccines works very well. They've been considered by the European Medicines Agency, which is the body that authorises their use across Europe. So all of these vaccines will be effective. But there are differences in the effectiveness between these 3 vaccines that tell us that 2, the so-called mRNA vaccines by Pfizer and Moderna, have a superior effectiveness. They will work a little better, and they are more appropriate, therefore, in our view, to those people who are over the age of 70 who are most vulnerable to the effects of this disease, because we want to ensure that the most effective vaccine is given to the people who are most vulnerable to the effects of this disease. The studies that have been done in relation to AstraZeneca haven't had long enough and haven't looked in the same way at the effects in older people. We fully expect that as we go on, we'll see more information that will give us further assurance in relation to the effectiveness of that vaccine. But we already know in relation to the AstraZeneca vaccine that we have substantial evidence that this vaccine will work very well and will be effective, and we're in a really strong position that we'll be able to offer that vaccine to the population as well. Operating on the evidence that we have at the moment, we know that we have an effectiveness of about 95% in relation to both the Pfizer and the Moderna vaccines. And so the right thing for us to do now is to prioritise the use of those vaccines that we know to be most effective, particularly in older age groups, where they have stronger data available to them. We fully expect that the data will evolve in relation to these vaccines, and we also know that more vaccines are going to come through the authorisation process and are going to give us further capacity to offer vaccine to the whole population. So to be in this position where we've got 3 really effective vaccines in a situation where perhaps 6 months ago we couldn't have predicted with certainty that this would be the case, this is a really strong position for us to be in, and gives us real hope for the future. Look where we are now. We've seen a substantial reduction in the incidence that we saw around the turn of the year and into January because of the measures that people are following. People are really following the public health advice, and we know that can work in terms of protecting the population. But we're now also in the position where we're rolling out vaccines which will protect individuals from the severe effect of this infection. And we believe in time, we have a strong hope, will also show benefit in preventing people who are given that vaccine from passing the disease on to other people. These are really exciting developments and put us in a really strong position where we can expect over the coming months that we'll be able to offer further protection to the whole population from the effect of this disease. As we go on, we as individuals and society will have to keep up a standard of public health practice as we vaccinate, but we hope with higher percentages of the population being vaccinated, we can offer further assurance to people that they are protected against the severe effects of this disease.